All right, so 20. True or false? Estrogen increases liver production of thyroid binding globulin, so you need more thyroxine. That is true. Estrogen increases liver production of TBG, so you need more thyroxine. Treatment of strep with penicillin is mainly to do what? Prevent acute rheumatic failure for sure. So use that penicillin to treat strep so you don't get acute rheumatic failure. What's the equation for a standardized incidence ratio? Standardized incidence ratio equals the number of cases that are observed over the number of cases that are expected. Continued use of glucocorticoids increases the risk of what? Osteoporosis. So you need to get a vitamin D and calcium if someone's using glucocorticoids, and supplement with those as well. The correlation coefficient, little r, can be between -1 and 1. If it's -1, it's inversely proportional. 0, it's no relation, and 1 is direct relation. Do not involuntarily sterilize mentally disabled individuals, obviously. A patient with suicidal ideation, if you get wind of that, what should you do? Hospitalize them and have one-on-one observation. If the patient with suicidal ideation says something, a good thing to say would be, I see you are upset, but we need to keep you safe while treating your depression. If a patient with suicidal ideation presents to you, discuss their options and remove guns from the home. Stroke in a young patient, what should be on the top of the differential? Treponema palladium, of course. I think they should get some penicillin as well. What happens in meta-studies that may overestimate true effects? Publication bias, right? An adverse drug event in the hospital, are those common? Unfortunately, yes, compared to other events. And if you have a patient in the hospital that's getting CPR, what's unique about this situation since it's so highly advanced medically? The use of pressors. So in a hospital setting, you can use pressors when administering CPR and max them out if necessary. What sort of dementia is associated with quote-unquote bad behavior? Frontotemporal dementia. They be acting naughty. Patients with cystic fibrosis or asthma may become allergic to what sort of fungi element? Aspergillus, right? And how do you treat aspergillic bronchopulmonary aspergillosis? With oral prednisone. So use oral prednisone to treat allergic bronchopulmonary aspergillosis. If your patients want medication like opioids, what's one of the first things that you should do? You should query the prescription drug database and follow up with them. Okay. True or false? Kids/teens have confidentiality as long as they're not harming themselves and others for the most part. That is definitely true. And note that sexually active minors should be screened for abuse and coercion. What is the first line treatment for TTP? Or first line, I guess. Yeah, first line diagnostic thing. You would look for increased activity of metalloproteinases. What medication that starts with a P can be used to treat akathisia? Propranolol is used to treat akathisia. What does a negative result on a highly sensitive test help do? A negative result on a highly sensitive test helps rule out the disease. Under obvious situations, you want to treat minors without consent from the parent, such as in a medical emergency, if it's STI, mental health issues, abuse, or if they're pregnant or want contraception. Also, if they're legally emancipated, financially independent, if they're a parent already, if they're married, or if they're an active military participant or a high school graduate. What medication that starts with an A is used to treat viral meningoencephalitis? Acyclovir. If you plan to give antibiotics to a pregnant patient, oh crap, tricked you. So if you plan to give antibiotics to a female, what should you get first? What sort of diagnostic test? A pregnancy test. What medication can be used in a pregnant patient to treat bacteria? Amoxicillin clavulanate. Obstructive BPH can be treated with what class of medication for the most part? An alpha blocker. And do you know an example of an alpha blocker that starts with a D? Doxazocin, right? Weird things like intrusive thoughts, violent images, and unwanted urges count as obsessions for obsessive compulsive disorder. Is that true? Yep. It can seem pretty weird. A patient with hypertrophic cardiomyopathy may benefit from what beta blocker? Well, beta blockers in general. Know any that start with an M? Metoprolol. Bow legs are fine for kids until they become like 7 years old, just FYI. If you have a patient and you suspect that they have sickle syndrome because they're like, oh, my eyes are dry and I need to drink water when I wake up and go to sleep because my throat's always dry. What diagnostic tests would you order? Rho antibodies, La antibodies, rheumatoid factor, and ANA. What is congenital toxoplasmosis associated with? It's associated with maternal ingestion of undercooked meat. And brain tumors are mostly secondary to what? Primary or metastasis? Metastasis. For a patient with acute pulmonary embolism, what sort of scan should you get? You should get a VQ scan. A patient with controlled pulmonary embolism may develop fever. Is that fine? Yeah, it's fine. It's just a side effect that happens. You just need to monitor them. Do not give them Tylenol or antibiotics or anything like that. If you have a patient that has hemoptysis, what's one of the first imaging modalities that you should use? A chest x-ray. What's the most common cause of hemoptysis? The most common cause of hemoptysis is acute bronchitis, so you need to treat with an oral antibiotic. And do not share patients' information, obviously, if you don't have their permission. And what class of medications that women typically use are associated with risk of venous thromboembolisms? SERMs. What does that mean? Selective estrogen receptor modifiers. Raloxifene is an example of that. If you have a baby with a big head on the growth chart, what's one of the first imaging modalities you should get? An ultrasound of the head.